you've got braces on. Just tell me a little bit about yourself and why you had treatment and what the problem was in the first place.
I've always been conscious of my teeth, really since being a teenager, and actually my daughter has recently had orthodontic treatment and her teeth has been straightened, and it was such a fantastic result, and it made me decide actually to go ahead and come and have a consultation.
Fantastic.
And go for it, basically.
Now you've got braces on at the moment, and you just started treatment a few months ago.
Yes.
You've got a particularly difficult problem in that your back teeth need to move backwards in order for us to get your front teeth straight. And we're using a new technique called mini implants to achieve that. You've actually got 3 mini implants in at the moment, which are little anchors that go into your top jaw. How do they feel?
Absolutely fine. I wouldn't even know they're there. They're actually fine, because obviously I was quite anxious about the fact of actually having the implants put in, because it is a new technology as well. But to be honest, when you actually did the treatment, it was absolutely fine.
It's really easy,
didn't feel a thing. No, it was fine.
Brilliant, that's the way it's meant to be, and that's where
so I'm really pleased, and I've noticed obviously already the teeth are moving back as they should. So.
And one of the fantastic things is you had some teeth taken out when you were younger, at a younger age, and that prevented us from treating you.
That's right.
A few years ago we wouldn't have been able to treat you, but now using mini implants we're able to move those top teeth backwards and then get your front teeth straight. And we haven't started work on your front teeth yet.
No,
but
that's the exciting bit. I'm looking forward to.
Hopefully in about 9 months' time we'll be able to have enough space to get the front brace on and get those sorted out. What would you like to say to people about having a brace on? You know, because some people might not have had experience of braces or know anybody with braces. What would you say to the audience about having a brace?
Well, actually, it's something I was quite conscious of, particularly being that bit older. Obviously, a lot of youngsters wear braces, and I was always worried that people might sort of look and think, "Oh, she's probably a bit old to have a brace." But actually, it does not bother me at all. I mean, obviously, it feels quite strange when it first goes on, but after I would say probably 3 weeks, you just don't feel any. You know, it just feels natural. It just feels normal. Totally normal.
And you can eat and everything okay.
Absolutely. Absolutely. So you just get it's like anything. You just adjust to it and get used to it.
What have you noticed the changes in the lower arch? Because in the lower jaw you've had treatment for a little bit longer than the top jaw.
Yeah, I noticed that very quickly.
What's happened there?
That was fantastic, because my teeth tended to sort of push up and be pushed together, and were quite crooked at the bottom. And immediately I noticed them changing, and now I'm so pleased, because I feel happier even just talking to people. The fact that if they're not looking at my bottom teeth thinking, oh, they're crooked, they're actually now straight.
So even though you've got a brace on, you know they're straight.
I'd rather have a brace on and have the teeth straight than be how I was.
Brilliant. Well, that sounds like really good progress.
I'm really pleased.
Okay, well, we've got a little bit more treatment to do for you, obviously, to get you completely finished, but I'm confident we're going to get a brilliant result for you, and you've been a brilliant patient. Are there any other messages you want to say to people out there about braces?
I just think if it's something that you're aware of and you're conscious of, it's worth going for. Definitely worth going for, because it's already, I'm halfway through and it's already made a difference to how I feel.
Fantastic. It's all about how you feel, really, not just how you look.
And just being able to, like I say, just talking to people, I'm not so aware of it.
Sure. Well, I'm hoping to get you a brilliant result, and thank you very much for coming in, and we'll catch up with you at the next appointment.
Lovely. Thank you.
Okay.